prepare all of the equipment first, and it is essential that donning is always done in the presence of a buddy for safety, and also to refer to the checklist. So for the purposes of this demonstration, I am effectively your buddy. So the first thing I'd like you to do is to use some hand gel and make sure your hands are clean beforehand. Now I'd like you to put on the surgical caps. It's really quite key that all of your hair is within the cap. This can be a challenge. The purpose of this is if there is any aerosolization, it just reduces the contamination to areas that are difficult to clean. These caps are not waterproof. Some guidance suggests you don't need a cap at all. Some trusts have chosen to use hoods, but Public Health England are happy with a surgical cap. So the next step is to put on your face mask. These are FFP3 face masks, otherwise known as N95s. Place the FFP3 masks on your face, which should ideally have been mask fitted. We'll use FFP3 masks specifically for intubation and other aerosol generating procedures. And these will filter out fine particles. And now at this stage, we'll take the lower elastic, place it to the top of your head, correct? And the upper elastic should be towards the lower end of your head, not on your neck, because when you are removing it and doffing, you want to avoid touching your skin, ideally. Pinch the metal strip over your nose and make sure there's a seal. And as you inhale quickly, you should feel it suck onto your face. So next will be the visor. So please place the visor over the front of your face with the elastic over your head. The national guidance refers to eye protection. It does not stipulate a visor. Goggles are also appropriate. The benefit of using a visor is it affords you a full face protection for a waterproof surface and avoiding aerosolization, but also contamination. Next, I'd like you to put on your first pair of gloves. Now in this technique, we're going to go through a double glove technique because that is the current protocol within this trust. Public Health England have updated this, and a single glove technique is also appropriate. The key piece of information to mention here and also later, any dirty procedure, such as examining the patient, inserting a line or a cannula, or intubating a patient, requires a second pair of gloves, and they are considered dirty. So for this, we will use the double glove technique. So the first pair of gloves are on. Next now, I'd like you to put on the water repellent surgical gown. So even though these are everyday use in theatres, the added benefit in infection control procedure and matters is that this is water repellent. So your buddy's job, and that's my role here, is to ensure that your neck is tied rather high to protect you. You do not need to tie it at the back as usual, but you do need to tie it to your left-hand side. Make it accessible. The reason for this is to ensure ease of removal and you're not reaching behind you when you're dirty. And tie it to the side. Intubation and carrying out lines, there is a high risk of an aerosol generating procedure, and intubation is defined as an aerosol generating procedure. For the purposes of this, we will use a further plastic apron over your surgical gown, which we'll put on now, please. Because you're clean, you can reach behind your back. So following our checklist, now we will place a second pair of gloves over these. So the sleeves of your surgical gown should be over your first pair, but the cuff of your surgical gown should be within the second pair. Ideally, gloves, a different set of gloves with a longer wrist are useful. It is also possible to use sterile gloves and surgical gloves, which are already designed with a long wrist, and they're quite suitable. So if we place 4 strips of Mi-Pore longitudinally over the gloves and the gown. If you just rotate your arm. Next, it's your buddy's job to check that you've put on your PPE correctly. So if you show me your arms like this, and then rotate for me, please. And I'm checking that you're overall covered, everything is correct and done. And finally, we'll move on to footwear. Public Health England guidance does suggest you do not need to use disposable clogs. However, we do need to be able to clean our footwear with Clorox wipes. So therefore, if you do not wish to have your own footwear cleaned with Clorox wipes, it is probably sensible and wise to use some plastic clogs as we have here, and these can be cleaned afterwards then. So for the purpose of this demonstration, we will assume you've already put on your clogs. You have now successfully and safely donned your personal protective equipment and are ready to look after the patient with COVID-19.